Hello and welcome to the second part of our lecture on trauma-informed care. So first we're going to start off with some basic ideas and principles behind the idea of trauma-informed care. And so of course, just to break down this phrase a little bit, trauma-informed care is when social service providers, so social workers, substance use disorder counselors, mental health clinicians, everyone working in this field, case managers, another example, those individuals that are working with people who have experienced trauma and the agencies that they work for that are serving people who have experienced trauma. The idea is that we are recognizing that trauma has happened for a lot of people, and we're shifting the way that we work and interact with people and the policies that we have so that they are more supportive of people who have gone through trauma. So that's kind of the idea behind trauma-informed care. So, basic principles, there are these 4 R's. So the first is to realize the impact of trauma and potential paths to recovery. So we don't at all want to turn a blind eye to the huge impact that trauma can have on someone's life. It's definitely not something to get swept under the rug. Of course, we know, especially with more and more research, that trauma is definitely very impactful on people's lives. So we want to realize the weight of the impact that it has, and also realize the paths that are out there to help people recover and to find some relief from these symptoms of trauma. And so the second R is to recognize the signs and symptoms. So as people that are working with those who have experienced trauma, we want to make sure we know we are aware of these trauma reactions when we see them. Of course, we went through some of the criteria for PTSD and acute stress disorder, and so those are good examples of signs and symptoms of trauma. So even if someone you're working with doesn't meet every single criteria and have the 2 or 3 required here or there, those are all still a great list of what trauma responses look like. And so to be familiar with what that looks like is important. That way, when you're working with someone, if you see a sign or a symptom here and there, you can kind of recognize that there is some underlying trauma there. And that's important for helping that individual begin to work through that and to get the support that they need. And the third R is to respond. So this is fully integrating the knowledge of trauma and the impact that it has into our practices and systems and policies of these agencies that are serving people who may have experienced trauma. And the fourth is to resist re-traumatization. So this is recognizing that having people talk about the trauma and tell that story again and again can be really re-traumatizing. It's recognizing that certain situations or certain individuals may trigger that reaction. It may be a reminder of the trauma that's happened, and or maybe the feeling of powerlessness that they had during the trauma. So we want as much as possible to make sure that as someone working with these individuals or as agencies serving these individuals, that the way that we interact and set up our systems are not going to create re-traumatization. So to put these 4 R's into a coherent sentence, we can envision a program, organization, or system that is trauma-informed, realizes the widespread impact of trauma, and understands potential paths for recovery, recognizes the signs and symptoms of trauma in clients, families, staff, and others involved with the system, and responds by fully integrating knowledge about trauma into policies, procedures, and practices, and seeks to actively resist re-traumatization. So a big idea with trauma-informed care is that we're shifting the question. So instead of looking through this lens of what's wrong with you, we're looking through this lens of what happened to you. So again, just because someone is experiencing these reactions from trauma, it doesn't mean that anything is wrong with them, but it is a good sign that something very wrong has happened to them. And so it's important to have that lens and to design our symptoms to recognize that these things have happened to individuals. And so we want to be part of the solution rather than cause any shame or guilt for a person experiencing what they're experiencing. So some key principles of trauma-informed care are safety, trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, voice and choice, cultural, historical, and gender issues. And so another graphic here that illustrates some key ingredients for trauma-informed care is leadership and communication, engaging patients in planning. So it's important to hear from those clients that we are working with that are accessing our services about how what we're doing impacts them. Is it having a negative effect? Is it having a positive effect? Is there a way that we could be more supportive? What's working, what's not working? Getting that from our clients can be really helpful. Training all staff, so making sure that everyone is aware of the impact of trauma and what those trauma responses may look like. It's creating a safe environment. So in our agencies, is this a place that people who have experienced trauma, is it a place that they can come to and feel safe? Can they come to your office and feel like this is a safe space where I can talk and work through these things? Preventing secondary trauma is another one. So again, this would be as someone who's working with someone who's experienced trauma, we want to make sure that we are taking care of ourselves as well and not experiencing any secondary trauma from that. So it can be important for an agency to set up certain protocols and policies to make sure that their employees are getting the care that they need so that that doesn't lead to secondary trauma. Building an informed workforce. So again, this is kind of the education and training for people that are going to be working in an agency. Involving patients in treatment. So it's not necessarily that the doctor or the therapist or the counselor has decided X, Y, and Z is going to be great for you, but it's really talking with that individual and getting their feedback and figuring out with them collaboratively what's going to be the next best step in working with them. Screening for trauma, so this can be a protocol that's in place, and we want to make sure that people aren't slipping through the cracks. There may be more people experiencing trauma than we may really realize, and so being able to screen for that and offer support when it's noted is important as well. Using trauma-specific treatment, so kind of looking at evidence-based practices and recognizing the ones that are most supportive of people who have experienced trauma, and then implementing those treatments is really important in an agency. And then engaging partners, so working with other agencies and other social service providers in our communities and making sure that we are all working together on this and collectively providing support to our community. So we'll touch on re-traumatization. So again, this was the fourth R in our 4 R's of trauma-informed care, and we want to make sure that we are resisting re-traumatization, so trying as much as possible to minimize its occurrence. So again, just to give a brief definition, re-traumatization is the re-experiencing of trauma as a result of a current situation that mirrors or replicates prior traumatic experiences. So this can occur when there are certain things or events, or situations, places, or people that remind someone of the traumatic event that they experienced. So some possible causes of re-traumatization may be when someone minimizes or ignores a report of a traumatic event. So basically saying, well, that wasn't a big deal, it shouldn't affect you that much, you just need to get over it. That would definitely be minimizing that, or just straight up ignoring it would also be a very unhelpful response. Another possible cause could be allowing the abusive behavior to continue without intervention. So this may especially play out in a group setting or a residential setting. Maybe there's a certain person that is kind of that reminder of the trauma for someone else. And if we, as the workers in that agency, if we don't intervene in the dynamic between these two individuals, that could lead to a lot of continued re-traumatization for the survivor of that. So that's something that we want to make sure is not occurring, and that we intervene if it is happening. Being insensitive to or inconsistent with boundaries. So it's really important that that we set the right boundaries as a provider of these social services. So we don't want to be kind of, I guess, overly available, that we've kind of crossed a line and now we're not helping the person, we're just kind of maybe enabling them or something like that. And we definitely don't want to be inconsistent. If we're saying, yes, this is okay in our program for you to do one day, and then the next day we say, no, that's not okay, you shouldn't be doing that, then that inconsistency can be really confusing and can take away that sense of power from a person, because they don't know what's right or wrong. You as a person in power are kind of changing the game on them all the time. And so that inconsistency with certain expectations can be very unhelpful. Requiring clients to tell their story multiple times, or when they go to multiple agencies to seek services, that can be really re-traumatizing to have to relive that every time that they're experiencing this story. And so that kind of goes back to some of our earlier conversations on the continuum of care, and kind of making our systems more streamlined between referring to different workers or different agencies. If we can kind of pass along information and have that system in place where it's okay for that information to be passed along, then we don't need to have everyone sit right in front of us and retell the story again. So that kind of reflects the need for certain policies in our continuum of care. So resisting re-traumatization at the agency. So there's 4 key strategies that an agency can do to minimize the occurrence of re-traumatization. And your discussion this week is going to be focusing on these 4 strategies. So first, I'll just kind of briefly go over them. So creating a safe environment is very key. Building protective factors with the individual, using a strengths-based approach, and enhancing provider resilience. So in your discussion, you'll see these 4 strategies, and there'll be a short little definition next to each one. And the idea is to come up with some ideas or examples of what an agency can do in either of these strategies. So you would choose one. So for example, you may choose create a safe environment. So in your discussion post, you would write about what an agency can do to create a safe environment. And so you can kind of brainstorm and maybe 2 or 3 ideas just to say, hey, these would be really great ideas for safety in an agency. And so I wanted to end on this idea of post-traumatic growth. Obviously, trauma is a horrible thing that happens to people and can obviously have a big impact on our lives. But I just want to touch on this idea through the frame of resilience and strengths-based approaches that there can be growth that happens after trauma. And so this graphic shows 4 factors that can lead to post-traumatic growth. Unfortunately, the first one up top got cut off, but it reads brutally honest optimism. And this idea of optimism is important because it can really reduce our sense of helplessness. And what we mean by optimism here is it's this faith that we will prevail and overcome. It's not necessarily just kind of, brushing over things and saying, oh, it'll be okay, everything will be okay. But it's really holding on to this conviction that I can do this, I can get through this, I can grow from this terrible thing that's happened to me. And I think one thing that's important to point out, and something that a supervisor had shared with me before, is that sometimes as the person that's working with these individuals, we may need to be the one that's holding on to that optimism and hope for them. They may be in a place where they can't see any of that right now. They don't have that sense of feeling like anything good can come out of this or anything good can happen after this. And so sometimes it's just us saying, that's okay, I get that, but I will hold on to that hope and have that faith for you until you can hold on to that yourself. And so it's really trusting in our ability to overcome things. So that's a really important part of being able to grow from trauma. The second is perception of control over events. And of course, with trauma, so much of it is that we don't have any control in that situation that's happened to us. And so recovering from that is really about regaining some sort of sense of control. And so this may be a possibility that someone can take a direct action to change the situation. So maybe they report a sexual assault, or they are able to leave an abusive relationship. But sometimes changing the situation isn't really an option, and so in something like that, gaining that perception of control over events is to change our orientation to the situation. So kind of similar to the optimism piece before this, it's being able to find meaning and purpose in the aftermath of all that has happened. So we have control moving forward over what happens next. The third factor is coping style. And so there's kind of two key coping styles that we can see in individuals, and one is an active coping style. And so this is really focusing on problem solving and planning and figuring out what's the next best thing to do now that I've experienced this. How do I really deal with what just happened to me? Whereas the second coping style is an avoidance coping style, and this is escaping and avoiding, running away from what has happened to us and what we experience because of what has happened to us. And this can be a short-term fix, and of course we see this a lot with substance use, that using substances do provide this sort of avoidance coping skill for us. And so it's the idea that, again, it's a short-term fix. So for as long as ever this high lasts, then I'll be free from this pain of what's happening. But that's only as long as the high lasts. And so, of course, it's short-term, and it can have long-term negative impacts if that's our only coping style, is only to avoid and do things to escape how we're feeling or what has happened. But if we're able to take a more active approach into problem solve and to think about what needs to happen next and to reach out to get that support, those can all be really important in helping us grow from trauma. And the last one here is a strong sense of self. So believing in our strength and our abilities, being able to think about our purpose in life and to have self-esteem, to make sense of what happened to us. And again, this is, like all these things, it's a process. And so again, really important for us as people that are working with those who have experienced trauma, to be able to utilize a strengths-based approach and to recognize and support someone developing their sense of self, because that may have been completely taken away from them because of the trauma that they've experienced. So as service providers and those that are working with people in these situations, our goal is really to foster this environment where these four things can happen to create this healing and growth that can come after trauma. And then the right side of this picture shows the things that can come out of post-traumatic growth, the positive effects that can come out of growing from trauma. So personal strength, closer relationships, greater appreciation for life, new possibilities, spiritual development. These are some of the things that happen when we grow from the trauma that we've experienced. And so that concludes this week's discussion on trauma and trauma-informed care. You do, of course, have your discussion this week regarding resisting traumatization, and then there's also a quiz on Canvas as well, so be sure to get those done this week. And then just a little preview of next week, we're going to be talking about working in the field. So the main ideas that we're going to touch on is kind of thinking through what are employers looking for, kind of looking at some of the steps for licensing and certification to officially become a substance use disorder counselor. And then we'll have a bit of our discussion on self-care and taking care of ourselves while we are working in social services. Okay, that's it for this week. Thank you guys for tuning in, and we'll be in touch.